So we've been doing a study called the ORION-4 study, which is looking at reducing cholesterol in people with pre-existing cardiovascular disease. We've been doing it at the Trust for about 5 years now. So this was just an opportunity that we were given from Oxford, where the chief investigator came up to talk to us to give our participants a more broader view of where they sit in the field of research, and also just to say a really big thank you to them, because we really appreciate all they do. We never ever take it for granted that people participate in research, and it's just, you know, it's just heartwarming that people have stuck with us for such a long time. So in Darlington we have 161. Most of them have been with us throughout the duration of the trial, so it's just absolutely fantastic. It's a really, really important study, and I'm so proud to be part of it.
ORION-4 is a trial that is looking at the use of a new drug called inclisiran, which is a drug that is given by injection every 6 months, and it lowers the bad cholesterol in the blood. And what we want to find out is whether this drug could be a useful addition to the treatments we already have in terms of helping to reduce the chance of having a heart attack or a stroke, particularly for people who are at high risk of such things. So that's people who've already had a heart attack or a stroke in the past. The study's been running for a few years already, and we've got a little bit longer to go, and we're really keen to keep the participants up to date with what's going on in the trial, and hopefully keep them motivated to stay with us right till the bitter end, because their help in the trial is absolutely what we need to get reliable results in this study. So this study is going to be really important in terms of helping doctors and healthcare providers decide if inclisiran is a drug that should be used much more widely than it currently is used. It does have a license already in the UK and in many other countries in the world, but it's not being used very widely. I think partly because the data that we've got so far on the drug are quite limited. People have only been exposed to it for a maximum of 18 months in previous studies. And what we want to know is if longer term use of this agent is safe, but also effective in terms of reducing the chance of heart attacks and strokes. And if that's what the ORION-4 trial does show us, then I'd like to think that it will really help to increase the uptake of inclisiran use, both in the UK but also worldwide. So I can't thank them enough for volunteering to take part in this study. It's a really big commitment. It's a long-term study. People are in the study for around about 5 years, longer for some. They come to a study clinic every 6 months. We ask them questions about their health, and they have an injection of the study drug or a dummy version of the study drug. Without the help of the people in Darlington and the thousands of others up and down the UK who are helping us with this trial, we simply wouldn't be able to answer these important questions. And I do think that this trial has the potential to really inform the treatment of people with heart disease around the world. So a really big thanks to the participants here in Darlington for giving up their time and being part of this research.